Tom Price would oversee programs as wide-ranging as Medicare and Medicaid. But first, he'd help lead efforts to carry out one of Mr. Trump's signature campaign pledges, repeal and replace the Affordable Care Act, also known as Obamacare. For more, we turn to Sarah Kliff. She's written extensively on the topic for the website Vox. What do we know about Congressman Price and the plans that he's already had in mind?
So he is a congressman who has spent a lot of time thinking about repeal and replace of Obamacare. He is the author of a 242-page replacement plan for Obamacare. He is the guy you would pick if you are quite serious about moving forward on Obamacare repeal.
Republicans have tried to do repeal and replace before. Even Speaker Ryan has a plan. What do these plans have in common?
So they generally cover fewer people than Obamacare. They would leave a few million people uninsured. The exact number depends on the plan. They're generally better for young, healthy people and worse for sick, older people.
How so?
They have a lot less protections for people with pre-existing conditions. They make it possible for insurance companies to charge more to those who are sick. That would be a really big change from Obamacare, which outlaws those provisions.
And then what does the pick say of Seema Verma, who's going to run Medicare and Medicaid, say about this new team that he's putting in place? She's worked on Medicaid expansion as a consultant for different states.
She is incredibly experienced in Medicaid policy. It suggests to me that the Trump administration is thinking about making some big changes to Medicaid, possibly adding premiums into the program, which serves low-income Americans.
And is there, when we talk about the changes that could affect millions of people, I know Obamacare gets this big umbrella thing, but really on brass tacks when it comes to specific policies that impact folks. So let's, for example, take contraception coverage. How could that change?
That's something that's very easy for a Trump administration, for Congressman Price in office to really turn back on day one. It's something that the Obama administration did in regulations. It's not in the law. They could rewrite those regulations to say that contraceptives are no longer covered under Obamacare.
And Congressman is against abortion. Congressman Price is, right? So, but it takes something else to try to get even your personal view put into legislation that gets passed by all of Congress.
Sure. So there is going to be a lot of back and forth, a lot of heated battles, just like we had around Obamacare in 2010. There will be a lot of infighting and figuring out what does the Republican agenda on health care look like? What is one that Trump and senators and Representative Price at HHS now, what can they agree on?
And what about Medicare? That affects a huge population also covered under this.
Yes, the Republicans have a pretty cohesive view for Medicare. They want to switch it to more of a voucher program where seniors get a set amount of money. They shop for different plans. One of those plans might be a government-run Medicaid. There'd also be private competitors, and they would kind of be using their set amount of money to pick whatever plan they could afford.
And how about the health, I guess, the health insurance that most of us get through employer coverage?
There is a big change to that in Representative Price's plan as well. He would cap the tax exclusion we have right now for insurance, meaning that the cost of insurance that you get at work, that could go up pretty significantly under Representative Price's plan.
And so all of these, of course, have political consequences. When you feel it in your personal pocketbook, you might choose to vote a different way.
Yeah, I think there will be things that Republican legislators like, that they like in policy and in theory, that are quite politically difficult to implement. The cap on employer-sponsored insurance is a great example of that. Democrats wanted to make the same change in 2010, but they found it was politically impossible to do so. I think Republicans will face similar barriers.
All right, Sarah Kliff from Vox, thanks so much.
Thank you.
All right, let's dig a little deeper now on the potential fallout for Obamacare and the people who use its benefits. Sabrina Corlette specializes in health insurance markets as a research professor at Georgetown University. And Bob Moffit is a senior fellow at the Heritage Foundation Center for Health Policy Studies. The Trump team has been meeting with people at the Heritage Foundation during this transition. So, Bob Moffit, what does this appointment signal to you?
It signals that President-elect Trump is very serious about the promise to repeal and replace Obamacare. The appointment of Congressman Price is the appointment of an individual who has a long experience in health policy in the House and has introduced legislation to repeal Obamacare and to replace it with provisions of his own. So I think from the standpoint of the administration, this is a very serious appointment. It's a very, very big signal to both the House and the Senate that the Trump administration is very serious about this issue.
Sabrina Corlette, he's had a 240-plus page plan already on the books. That's in addition to all the other Republican plans that are out there to repeal and replace.
Right. I think one thing that Mr. Moffit and I would absolutely agree on is that the nomination of Mr. Price is a clear signal that the repeal of Obamacare is a top priority for this new president. However, I don't think that we can say anything that the that the Republicans have put forward, including Mr. Price, constitutes a replacement of the Affordable Care Act, because none of the proposals, including Mr. Price's proposal, would cover nearly the same number of people that the Affordable Care Act covers, nor would it provide the same consumer protections for people with pre-existing conditions.
Now, Robert Moffit, again, the plan does not exist. This is we're talking based on what he's proposed before and what other Republicans have proposed before. What's the cost that maybe the new administration is willing to tolerate in the number of people that got?
Well, I think that the president-elect himself made a comment at the very beginning of this and actually put it in print that, in fact, nobody should fall through the cracks. Remember that Tom Price is an orthopedic surgeon, so I think what we're looking at is a surgical approach to the Affordable Care Act. I don't think what you will see is any kind of massive disruption. I think the major concern right now for those of us in health policy is that we are already facing a massive instability in the insurance markets, particularly in the small group and the individual market. With premiums jumping 25% nationwide, average premiums in the exchanges, and then with these breathtaking deductibles. For a family with a bronze plan, you're talking about a $12,000 deductible. Health insurance is becoming less and less affordable for millions of Americans. The people in the exchanges is only one part of this problem, But you got about 10 million people in the individual market outside of the exchanges who do not get any subsidies at all, who are being affected by this. And then you also have another 15 million people in the group market, so small group market. So this problem that we have right now with affordability and cost and the instability of the insurance market is affecting millions of people. What that means is that the administration cannot waste time on this. They have to come to the rescue of people to make sure that those who have coverage don't actually lose it, and we have higher rates of uninsurance as a result of it.
Sabrina, Corlette, how do you take a surgical approach but also contain costs?
Well, I'm not sure how you can take a surgical approach based on what we have heard Mr. Price and other congressional leaders, as well as the president-elect, say. They have called for a wholesale repeal of the Affordable Care Act. That would include the expansion of Medicaid, which is the program that covers low-income people. That would include a repeal of the tax credits that help moderate income people afford coverage, as well as the individual mandate, which is supposed to get healthy people into the pool and make coverage more affordable across the board. Once you repeal all of that, that's going to cause massive disruption in the markets. That's going to throw as many as 22 million people off of coverage. Now, Mr. Price has put forward a bill. However, the tax credits that it provides are a tiny fraction of what the Affordable Care Act provides to people. They are also not income-based, so they heavily favor higher-income people over lower-income people. And then if you have a pre-existing condition and you have even a tiny lapse in coverage, you're left out in the cold.
Mr. Moffit, this is also on the heels of President-elect Trump coming out and saying, listen, you'd like to preserve the clause that says you can't discriminate on pre-existing conditions. I think that's almost universally agreed. There's nobody that wants that.
There's nobody who's arguing that we should exclude individuals from health insurance coverage because they are sick or they have a pre-existing condition. I mean, that's nonsense. That's never been a debate. The question is, what is the best way to do it?
And how do you pay for that?
Well, you're going to have to pay for it in any event because we're paying for it one way or the other. If people do not get access to health insurance and they end up in the hospital emergency room, the most expensive place on the planet, taxpayers are stuck with the bill. So we have got to address this. Frankly, I think that a mainstream proposal right now that is circulating among House Republicans is to adopt one of the practices that we have in group insurance right now under the Health Insurance Portability and Accountability Act, which is this, is that if you have creditable coverage, and you move from one job to another and join different types of groups, you cannot be rated up, regardless of any kind of pre-existing condition. Yeah. We do not have any kind of crisis of pre-existing conditions in employment-based health insurance. The problem is in the individual market. If you're going to be personally responsible and buy insurance at an affordable rate, you can do that. Otherwise, you can be rated up. That puts the responsibility where it belongs, on the individual who is buying the insurance.
Well, for people who have come off an employer-based plan, that typically means they've come off because they've lost their job. it can be very difficult for those people to afford the premiums that you would have to pay to maintain health insurance coverage, particularly given the fact that the tax credits that some of these Republican proposals are talking about are paltry. So what would happen is if you skip some time and go without coverage because you can't afford it, you can't afford the premiums, what some of these proposals would do would effectively lock you out until you either get back into an employer-based plan or become eligible for Medicare.
All right. This is a conversation, and the legislation will eventually make its way to Capitol Hill. We will have you back then. Robert Moffit, Sabrina Corlette, thank you both.
Thank you. It was a pleasure.
All right.